Great. So, Jeremy, get us started. Who are you for those of us who don't know you?
Well, thank you so much. Well, I'm the founder and the CEO of a lovely agency called Listen and Learn Research. And our job and our mission in life is to try and make sense of social, because someone's got to, right? And by that, I mean that we're trying to create audience, patience, cultural and influencer insights that enable you to really create engagement and scale your impact. It's trying to use the conversations on social as a really meaningful way of understanding how to have an influence on people's lives. Put simply, we're here to really help you be more strategic, more creative, and more innovative by giving you a better understanding of what's going on in people's lives and how they then interact with each other through social and the role that culture and influence does to bring all that together.
So that all sounds fantastic. And for those of us who aren't overly social, what we're going to do in the next few minutes is unpack that so we can figure out what he actually means by that. So let's start with more on the personal front. How did you get into this? How did you found Listen and Learn Research?
My background is in traditional research, so lots of business development, but I've been in traditional research for about 11 years before I started Listen and Learn. And it's really doing focus groups, doing questionnaires, running online brand communities for people. So really a grounding in solid research. And I come at social data and my colleagues come at social data with traditional market research mindsets. So we're not technologists. We love the tech, but the tech only gets you so far. It gets you a dashboard and you look at it and go, that's kind of interesting. I was kind of hoping for more. It's the kind of hoping for more bit, which is where we fit in. When I started the business 11 years ago, I think back, and this is when Facebook was still emerging. It's hard to believe it now that there wasn't Instagram, there wasn't TikTok, there weren't these places. There were loads of great communities, but it really wasn't the thing that it is now. And the potential that I saw was just this ability for social data and social media to create spaces where people were able to engage with each other more naturally. And that was the spark, is just looking at that content and going, wow, this is really interesting. It's really natural. It's really raw. It's really intriguing. And then coming at it from a kind of normal research point of view, I'm seeing things that I wouldn't think to ask. I'm finding insights that I wouldn't know to look for and to dig around and trying to explore. And that for me was really exciting. And at the time, there was no real solution for it. There were a few social listening tools, but most researchers were finding out about social by asking people how they used Facebook, which is like behavioral rather than actually using the source data itself as a thing to get excited about.
So you mentioned a lot there, market research that many people on the phone probably understand. We understand focus groups, we understand qualitative, quantitative research. So what actually is social insight, social listening? What is it that you all do?
Yeah, so it's a great question. So I think where I put this thing. So I think market research is great. I've come from it. It's got a long history. I think it's fantastic. But we have to bear in mind that people don't talk to researchers the same way they talk to each other. And if we understand that, and if we're happy with that as a paradigm, then actually we need to think more broadly than the tools that we've had up to this point. And the tools that we've had are great, but they are the tools that we've had. But the advent of social media, for me, is an evolution in market research, because it's a whole new data set that we can play with rather than a refinement of what we were already doing. It's not a better focus group. It's not a better survey. It's a completely different data set, and it's observational. So it has this real interest. And so I see the market as a big circle with market research in, another big circle with social listening, and then a thin intersection between the two, which is where we sit. For me, social listening is an analytics tool predominantly. It's designed for tracking, campaign monitoring, finding out key influencers, that kind of thing. But when you scratch the surface of social listening, it's not very deep. The data's there, but the tools don't enable that analysis. And that's really where my agency focuses on, is that intersection. It's an appreciation that you've got people talking to people, and the beauty of that data without bringing my agenda in and skewing that conversation. So people can be vulnerable, they can be emotional to each other, they can be dumb, they can be extremely frustrated, they can be everything that we are when we don't think anyone else is really watching. And the lovely thing about social is it enables people to be anonymous. It takes away some of that, I can be really open with you because you don't know who I am. And bonds form over time, but it's a really beautiful thing to be able to get hold of.
I think that's fantastic, because what we know from the behavioral economics perspective is people say one thing and they do another. And what you are focused on is like what people are actually doing.
Yeah.
And so quite powerful. Is there a recent aha that you've discovered that you were surprised?
Yeah, if anyone follows me on LinkedIn, you'll know that I've got a bit of a thing for TikTok. I think it's amazing. I think it's just incredibly raw. And I
Us in
have
the US might not have it by next week, so just
well,
want to
good
add.
luck. Use it while it's there. And my point on that, if anyone's curious, I think short form video is here to stay, whether it's TikTok or not. I think short form video, now that that cat's out the bag, is so powerful, so influential that it will be someone that will take the crown if it's not TikTok. But I think this is the thing that's interesting to me is so the aha moment is there's everything there. So I was doing a presentation for a pharma company. One of their specialist areas is obesity. And I thought no one's going to be talking about obesity online. No one. And it's huge, right? That we measure engagement in how many people use certain hashtags and use those hashtags to tag their data. Obesity is being viewed over 1 billion times. It's enormous. The other day I was looking at, we're scoping out a project on urinary incontinence, and I was looking at catheters, and lo and behold, there's a whole set of communities, people talking about catheters. And so it's fascinating. And what's really the aha point about this is actually how they construct the meaning around what they're trying to do. So the obesity conversation is around the challenge, and it has this lovely thing of a surgeon, a patient, and then a personal trainer all debating some of the issues. The catheter conversation was a load of nurses sharing techniques. And I wouldn't have thought it. There's no way it would have come into my head. But when you look at the data, that's where the aha moments come from.
Fascinating. So social media, for those of us who are on the older side, you think it's not representative of the population. What's your take on that? Like, does it tend to be skewing younger? How can we segment? And I know a lot of people here are interested in Medicare, so any of those over the age of 65, like, can all of that be brought together?
Yeah, I think it's a great question. And I think it's not right to judge a new tool by the standards of the old tools. Do you know what I mean? It's like it's a different thing. It's not the same. So to expect social media to behave in the same way as a nat rep sample is kind of missing the value of it. We've got our nat rep samples already. We don't need another one. What we do need is a different perspective. So the answer to the question is it representative? We don't really know. It might be, but it might not be. We just don't have the data that we normally have. My other take on that is, yeah, it is representative, and it's representative of choice and influence. So if it captures your experience in trying to understand a change in your life, then what you're going to see is so the path through the internet is knowable and quite short. So if you've got a disease, if you've got a condition, you're going to end up at patient info, WebMD, Mayo Clinic, Health Unlocked. These paths are the paths that you're going to do. If you're into TikTok, you're going to find those communities. So what social data is representative of is the experience that someone's likely to have when they're looking for information. Does that make sense? So you're capturing that whole consumer patient journey is all knowable and all capturable. And so that's when you start to get into the different pockets. And when you're looking at different demographics, and particularly around different health outcomes, that's where you find your rare diseases. That's where you find older communities. That's where you find people that are coalescing around certain needs because they need to validate their emotional experience. They need to help explore what they've been told. They need to build on that. And that's why they come together.
So how much of this is like local, regional, national, international, as we think about this? Because if you think of who's on this call, some people are looking very micro, some people are looking very global.
Yeah, it's a great question. I think it's really about how you focus the study. So there's you can bring it down, but the web is the internet is global, right? So you'll find communities, particularly around health outcomes and healthcare, where people are coming from all different systems. And it's really interesting because then you'll be talking about what drugs are available in different markets. And then you'll be going, okay, for this, and then it's not available here, it is available here. What can I do about that? Okay, I can then go and talk to other people. But then if you want to make it really micro, you can zone in on conversations per area. And then you sort of just then localize it both through language or through using different tools to try and zone it in. So it's all brands are going to go, okay, right, we're going to do this market and that market and that market. And the internet just cuts across all of that, as you know, right? It's one of those, people go where the money, where the information is and where the help is, rather than sticking to geographics. And so it's interesting to see how that maps onto what people are trying to achieve.
So as you think about this, can you dive in and can it help address health equity or health inequity? Whichever perspective you want to take on that.
Yeah, I think for us, it's really about trying to understand the struggle. and trying to understand the nature of that struggle and where that's coming from. So it's like they're not going to do it in that term, but it's about understanding a lack of access or a lack of support or a lack of information or a lack of ability. And that's where you get the sources of inequity from. And that's how you think about, okay, how do we then address those by a better understanding of the different patient pathways and different patient journeys that people are going.
So one last question, and then I know we'll have time at the end.
Yeah.
If you could do social insights for one part of healthcare, what would it be that you think would be most interesting or that you'd want to dive into?
Yeah, I think the thing that if I had to sum up if you have to sum up the use case in one thing, I think it's really around articulating patient need and patient and carer and that thing. I think social as a source is extraordinarily powerful in landscaping and just understanding what people are going through, and that opening yourself up. And the result of that is that being able to really clearly articulate patient need. Does that make sense?
It makes complete sense, and I'm excited to learn more.
So tell me about you.
So for those who don't know, I'm Karen Horgan. I am co-founder, CEO of Val Health. Started the firm over a dozen years ago. We are a US behavioral economics consulting firm focused solely on health and healthcare because it is a national, international, global problem. And we take the academic thought leadership generated by my co-founders, bring it together with our dozen years of experience, and we help drive engagement and improve outcomes.
I love that. So why is it that you do what you do?
What gets me out of bed in the morning is it's fun, it's challenging, it's exciting. Like truly, I feel like there's a purpose in what we do. Beyond that, I do it because there's a global health crisis. And when I say that, most people think obesity. I mean, you mentioned that there's 1 billion obesity hashtags. Like that's just incredible. But what the real crisis is engagement. People aren't doing what it is that they need to be doing. They're not going to the doctor. They're not getting preventative screenings. They're not taking their medications. They're not eating right. They're not engaging. They literally want to eat their cake and be healthy and do all of that. And so this is where behavioral economics comes in. We understand that people are irrational, and the typical market tries to give the user information and say, oh, go get your colonoscopy and everyone's going to run out and do that. And we know it doesn't work. And even the data shows us when calorie labeling was introduced in New York City, people purchased the same number of calories before and after. And what we do at Val Health is we harness people's irrationalities. We harness the fact that we have a bias to the present. We have an aversion to loss and regret. We overweight probabilities. And we don't ask people to change that. We bring that into programs and how do you optimize journeys and communications to nudge them to do what they have a hard time doing. So for example, with Sutter Health a few years ago, they wanted to increase the rate at which women were going in for pap smears. And we had a very focused touch point. All we could do was change subject lines and email content. And rather than telling people this is what the US Preventative Task Force recommends, we brought in social proof and we got 2.1 times as many women to go in for their pap smears, which is quite
Amazing.
Powerful.
Yeah, absolutely incredible. Well, so you sort of talked about one of those issues. What do you think is sort of the hardest problem to tackle, and what makes sort of like behavioral science the right answer to those challenges?
The hardest problem, that's really hard to pinpoint. But if I had to, it's inertia. It's that whether we are a patient, we are a consumer, we are a provider, we are stuck in our ways. And let's talk about, I'll be US focused. Let's talk about patients. And if someone actually decides that they want to go to the doctor or they want to get a medication, we as a system put in so much friction and make it so complicated for people that their inertia wins over. People don't understand their health plans. They don't understand how much something's going to cost. Offices aren't open. They can't get an appointment for 6 months. Like all of that, we're just adding to the difficulties. And so people are like, whatever, I'm just going to not do it. And on the provider front, what they learn in med school is what they tend to stick with. They're overburdened, they're overworked, they're burned out, especially from the pandemic. And asking them to do one more thing or change what they're doing is truly complicated. So again, I put out the bad. I'm going to talk about how behavioral economics or behavioral science, however you want to frame it. How does this work? We can make the right path for people. So one of the programs we did was trying to get patients into a remote monitoring program with a provider's office. And letters were sent out to the patients. And one set said, do you want to schedule an appointment to come in? The other said, I've scheduled you for an appointment, come in. And twice as many people showed up when they were already scheduled for an appointment. Like the inertia, it was just inertia was, oh, I'm supposed to go in at this date and time. So we used inertia to our advantage in that case. Or with doctors, trying to get them to take actions with patients based on test results. With one diagnostic company we worked with, we transformed the report that the doctors used, and 77% of clinicians took action based on the report, which the system was phenomenally floored with how large that number was. Because we made the right path the easy path. We knew they wanted to practice their medicine, but we gave them the information they needed to take action. So if we can use behavioral economics to overcome inertia, that's really powerful in healthcare.
I love that idea of making the right path the easy path.
Yeah.
I think you need to structure my day. So I'm probably more of a shove guy than a nudge guy, but why should we be nudging over shoving?
I oftentimes want to shove too, but we know it's not going to work because people don't necessarily trust the institution. And if we try and shove people, they're going to have even more of a negative reaction. Like think about vaccine hesitancy. I mean, here in the US, phenomenal. Like globally, there's some issues. And so if we try, people will shut down, deliberately take the other path, all their defenses will go up if we try and shove. And so the nudging, if it's somewhat, asymmetric, paternalistic is what we think of how do we make the right path the easy path for them, but not take choice away. Like make it so they're defaulted into one path and that they have to double click to go to the other path that's harder. If you want them to go through PCP versus emergency room, design it some way so that way they're more likely to use one path versus the other.
Yeah, great, amazing. What have been your favorite nudges when you look back over a history of nudging?
Well, I'll talk about some of the ones we've done, and I could talk for quite a while. But one of the ones I want to talk about was done by one of our co-founders, David Ash. He's the A in Val. When he was at Penn Medicine, which is a hospital system in Philadelphia, for their employees, they wanted people to go get their blood pressure taken, to know what they should be doing. And if they could have put up flyers, done information. And what they designed was a program that bundles wants with shoulds. People, and they brought in puppies for the day and called it Puppies and Pressure. And people want to pet the puppies, but they should get their blood pressure taken. And they had like a phenomenal response to that. And even better yet, by the end of the day, all the puppies were adopted. And so if you think about how do you make it fun, but bundling wants with shoulds, that can be really powerful. There's a couple more. One of the other ones I've mentioned already was the women going in for pap smears with Sutter Health. And really proud of the team because within the first 90 days, over 5,000 women found out about abnormal pap smears, which are not great, but the whole point of preventative screening is to find them early. And so really proud of the fact that all these women's lives were impacted, could possibly be saved because of the nudge, and it was not a shove. And then one of the last ones I'll bring up is there's a lot of work we do around digital health and getting people into digital health programs, whether it's through employers, direct to consumer, through payers. And we think about this as different phases of you want to launch, learn, and last, and how do you get people in and stay engaged. And working with one of the leading diabetes management companies, we got a 35% increase in enrollment by changing the content of the direct mail that went to the home. And we reframed it from all of their facts about you get coaching, about this and that. And we brought in, recreated the physical meter because we knew some of the hurdles to people adopting were, well, I have to change my meter, I have to do this and that. And so we incorporated a bit of endowment effect of their holding this in their hand. We brought the future to the present of thinking this is what I'll be doing and made it salient of the impact. And as a result, that 35% increase they were ecstatic with. And I bring this up because a lot of these programs I've mentioned, it's just a lot of the small little nuances are what makes behavioral economics so powerful. Like people should not know that the black magic is being put on them. If they know that, like probably I am biased. I probably see this all the time. How many retail emails can I get a day? Don't miss out, last chance. Like that's behavioral economics, but that's so overused. And so we really try and bring in the subtlety that gets people to take action.
Yeah, amazing. So what happens in your mind when the black magic, when the nudges go wrong?
Oh, behavioral economics for bad. I do not have any examples from what we've done. I'm going to put that out there.
Of course.
But there is one that we talk about, which was in the electrical industry outside of healthcare. And when they go wrong, they're usually around social proof and using social proof in the wrong way. And what the electric company did in California, they were trying to get people to reduce energy consumption. and they sent letters to the home saying you're overusing electricity compared to your neighbors, or you're underusing electricity compared to your neighbors. And those who are overusing electricity, they reduced their consumption. Those who were underusing, they cranked up their air conditioning. Like, why should I sit in a hot house? Like, everyone else clearly isn't doing this. And so it's that boomerang effect of, you want to make sure you're anchoring and setting the stage appropriately. And the second time around, they did this and they told everyone, said that, but they gave everyone a handwritten smiley or frowny faces. And across the board, everyone reduced their consumption. And no matter how old you are, it's the inner fourth grader in all of us. We want to get that feedback. And in healthcare, social proof has to be used very carefully, because around the world, if you start saying, 2/3 of people are obese or, or overweight, people are like, oh, that's me, that's normal, I can keep eating. Or if you talk about 3% of people are using this digital health app, you're like, well, no one else is, I'm not going to either. And so we want to be selective in how we use it. And a lot of the ways can talk about growth, like double the number of people signed up last month. Because if you're going from 3% to 6%, it's factually true, but it's really easy to show. And so I encourage you all, if you are going to incorporate social proof, just think about the boomerang effect and what that could be.
Amazing. Final question, ending on a positive. What do you think, in your mind, from what you've seen, what makes for a really great nudge?
I've probably already said it, but I can't say it enough. It's make it so people don't realize it's happening. How can you make that right path the easy path? And if, like, an example we did was with the state of Michigan when they expanded Medicaid a few years ago. The governor wanted to have the expansion population take a health risk assessment, so they knew what they were getting in their hands. And they were at 8%, and they contacted us and they said, how much do we have to pay people to do this? Because you notice with behavioral economics, this is the first time I've mentioned money and paying people this entire conversation, because it's not the path that we really encourage. So we did our project, and at the end of the day, we said, don't pay them anything. Just change the order in the process in which you ask the questions. So if you've done any kind of government forms, you're filling out forms and a lot of questions, and there's inertia, right? You're like, I've got more questions, fine, what's the next page, blah, 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 blah. And then we put the health risk assessment as part of those questions, that when the person had the inertia, they just kept doing it. And we went up to over 90% of people completed it just by changing the order in which the questions were asked. So people didn't even realize it was happening, but that was the behavioral economics magic of, instead of trying to change the inertia, we played on it to get people to take action.
Wow, fantastic.
Thank you, Karen. Thank you, Jeremy. I think hopefully we're all feeling a little bit more informed about both social listening and behavioral economics. So let's bring it together on one focused example. Karen, you brought up vaccine hesitancy earlier. Let's dive deeper on that, knowing it has been and still is very much a hot topic. Jeremy, can you start out telling us what the social listening, what the research shows, and then Karen, can you address how behavioral economics can help address those issues?
Yeah, I think it's a great example. We've all got views. My view is fairly pro for lots of different reasons. And I think it's interesting when you look at the narrative around vaccine hesitancy, that it's quite holier than thou. It's very sanctimonious. It's very, look at, you should be doing this, you should be doing that. There's such a profound sense of righteousness from the pro-vaccine society. What we found getting into the data is actually it's more subtle than that. And it's really around this argument where if people don't appreciate your point of view or your standpoint, you reiterating that standpoint increasingly aggressively and dominantly isn't going to change their mind. And it's also this idea that actually a lot of the ideas around vaccine hesitancy are grounded in valid opinion. And so it's not a binary issue. It's not you're right. It's not the science is going to beat the non-science or the alternative facts or whatever nonsense ways we want to describe it. It's subtler, it's more complicated, and it's grounded in a reality and an experience and an opinion that goes back. And when you think about where sort of this kind of like the influence to or what decides what drivers affect your ability or your tendency to vaccinate, you have to understand there's a broader cultural context which is different per market, and that's to do with how health systems are developed over time, health scandals in different markets in different places that linger in the consciousness. And then you have like a set of core influences, which is around your ability to trust. So how trusting you are of institutions, of individuals, of doctors within that environment, your perceptions of self and society. So what you think about your own morals, your own sense of social responsibility, whether you believe that the individual trumps the ability to or the need to do the right thing for society. And then you get this other underlying sort of like personal core influences, which is around fear. So it's I mean, we've sort of framed our work as, are you more scared of the vaccine or are you more scared of the virus? Because it's a really interesting domain and people have got really valid opinions across all of that. And then so those are what we found as being like the core influences. And then you have a set of like what we thought of like personal priorities. And one of these was this drive to get back to normal. So if you have a really strong drive to get back to normal, then you're more likely to be pro-vaccine because that's your ticket back into it for one way. You have another set of personal priorities around your values and your ideology. So this is around your personal values, what you believe to be true, your political stances, your attitudes, your judgment. This is where the them and us comes into the debate. And then the last sort of priorities is around your views around vaccines and alternatives, and whether you view each of those, like how vaccines were developed, the speed of them, whether the speed is too quick for your perception, and whether you think alternatives are viable. So instead of it being a real binary, I'm pro or I'm anti, there's also this middle ground where I'm not quite sure. And I suppose what we've learned is that it's much more nuanced and it's much more complex, and it's those opinions are valid to the people that hold those opinions. Either they're pro or they're anti. And by using the arguments of one side to try and convince the other in a blunt way just doesn't work.
I
It
think
needs
that is
Val in
quite
your team.
that is quite compelling, and I'll also start and say I'm pro-vaccine. I'll just put that out there. I have as many shots in my arm as they will let me. But I think you brought up some really interesting points there in terms of, for those people who are going to run out and get the vaccine like myself, we don't need any nudges. We don't need any behavioral economics. I'm on the pro side. I'm doing all that. But and then there's some who are on the extreme con and negative. And from a behavioral economics perspective, we're not necessarily going to address them. We want to address that middle ground of people who have their factual opinions, who have reluctance, and how do we overcome those hurdles? And so you mentioned something about, trusting the system. And so one of the ways that was done, and I'll focus on the US, but there's a lot about social proof. You have Barack Obama up there getting from a national authority, particularly for Black Americans. And then there's a lot of local work that we've seen done. Emily and I met with a pastor in Tampa, Pastor Dames, and he has this church, and they received over 90% vaccination rates, which is phenomenal because that is the exact population that you would think would be pure hesitancy, non-trusting, but they're also the population that very much needed the vaccine, because when you look at them, they are the obese, chronic conditions, diabetes. And so that's really powerful to show how you can get socially local and it can make a difference. There's also, and I'll bring it up again, the right path, the easy path, and how is friction eliminated. So for those who are ready to go get their vaccine, like they've finally decided it, aside from the first few weeks when you couldn't get an appointment, after that, it was relatively easy in terms of if you didn't have insurance, it didn't matter. There was no cost. You didn't need a credit card. You could just walk in. It was in your neighborhood. You didn't have to take 2 buses to get there. There was even door-to-door efforts, so bringing the vaccines to them. So trying to, once people mentally got over using a lot of social proof, how do you eliminate any of the friction? And then there are some states that tried lotteries. And again, I don't want to sound negative on money, but those lotteries, and there was a big paper, results analyzed by Dr. Kevin Volk, the V in Val, and it showed lotteries didn't work. Just throwing money at people didn't help. And it actually created a little bit of a boomerang effect when people needed to get a booster. They were just waiting, when are you going to pay me? And so there was, how do you shift mindset to be a bit of, get the intrinsic motivation versus the extrinsic? So I'll stop there because I know we're past 12:30 and we want to leave time for questions if there are any.
Let's open it up to the group for questions. Feel free to either raise your hand or jump in here.
You can also use the chat if you prefer.
Or use the chat.
So I'm Laura, and I do have the question. So Kieran and Jeremy, I'm curious, and I'm gonna through the lens of both of your fields of work, I'm gonna raise you up a notch and ask you to each comment on this. But when you think about the experiences you've had and what you've actually seen people do or not do, what are some of the biggest indicators of how trust is created and how trust is broken?
I knew you'd have the hardest question, Laura, so I'm gonna let Jeremy go first.
Well, and
Oh, that's great. Thank you.
I don't know if it's a hard question, but I find it
It is.
interesting because, if you think of like, I'm kind of hearkening back to like O'Reilly's book, and when you think about telling someone that you're my friend, you're my neighbor, and then you change the conversation, you talk about financial transactions, and they go, you're not my friend and my neighbor, you just want my money, and then you never get it back again. So that when I was listening to you both talk about what you're listening, what you're seeing, what you're observing, how you want to do it subtly, and trust being one of the biggest things that precludes someone from actually changing a behavior. That's why it made me want to ask the question to see if you had any insight.
Yeah,
Jeremy,
it's
I'm
an
happy to
amazing
go
question.
first if you want. I think it's if you use defaults in the wrong way. I think if you default people into things that they're starting to feel like this is about you, you see that a lot with payers and trying to get you to not go to the emergency room, or payers trying to get you to go for preventative screenings or claims denials. They start to say, well, this is all about you. This is not about me. And so that's why we have to be very careful in terms of how we use defaults.
That's a great example, Karen.
Yeah.
Thank you.
I think from my perspective, what we see when trust breaks down is that I think of trust is like a default position. I trust you because I don't want to think about it. Do you know what I mean? I don't want to challenge
Interesting.
myself to re-examine that relationship. So I trust you. So trust is earned over time, because it's like, you're okay to me today, you're okay to me today, you're okay. I'm going to assume you're going to be okay to me tomorrow. So when things aren't are lacking transparency, for us, it's a lack of transparency, to Karen's point, it's a lack of empathy. And it's when things start to jar, and it's when systems don't quite gel up with what they would reasonably expect to happen. What you're doing then is undermining that trust and undermining that process and creating suspicion. So it's like, this wasn't what I thought it was going to be. I therefore need to spend a lot more emotional energy and intellectual energy trying to just validate and understand where I am in relation to what you're doing to me.
Yeah,
Jeremy, I
create
think that's
suspicion is a great phrase for that, right?
It's creating that trigger for people to start to question you.
Yeah.
And you want to ride the inertia of trust until you create a trigger for them to start to question it.
That's super helpful. Thank you.
I have a question. Jeremy, I'm struck by the modernity of your language, and yet you have a turntable over your right shoulder there, which is a striking difference. But your social listening seems like it is just so amorphous. There's so much stuff. How do you structure it, and how do you structure it in a way that's compelling versus just one interpretation, as opposed to something that's equally logical with someone looking at the data in another way? It just seems like it's such a random set of stuff that you're trying to think about.
That's a fantastic question. You get bonus points if you can tell me what decks I've got. Their Technics SL, their Technics 1200 SL2s classics. It's a wonderful question, and it is. So when I set up the agency, I was looking for modes and I was looking for frameworks to help us do it, and I stumbled across a framework called Grounded Theory, which was designed in the 1960s by a guy called Barney Glazier to interpret large scale like text data from interviews. And essentially what you're doing is you're decoding signals within a set of data. So say I've got, as an example always stick in my mind, a guy had left the doctor's surgery, was sitting in his car, was on a cancer support charity's website, trying to explain to people that he'd been diagnosed with cancer, wasn't going to tell his family, was going to just deal with it all himself, like the classic idiot bloke, right? Just, I can deal with it, it's going to be fine. So all of this just really sticks in my mind. To me, when I look at that, I'm going point of diagnosis, emotional response, coping mechanism. All of these signals are triggering out, and it's just a way of thinking about data. So you consume data differently to most people because you're looking to deconstruct all that meaning. Once you've done that, what you soon find is when you look across a butt, you start to see the same things happening again and again and again. So you have a set of codes about emotion, about context, about situation, and then through that process, you're able to group them together. Once you've done that, you've developed a framework which you can then use to interpret large volumes of data. And so you're starting with codes, you're building your codes into categories. Your categories then help you define hypotheses. So what our job is to wade through all of that and make sense of it all. So it might seem like cacophonous, but to me, That's the void, that's the mess that we start with. And it's a bit like just herding cats in these points. And then what we've done, once we've got to that point, we can then go, okay, we're starting to see some themes coming across. What are the meta themes? How do they hang together? And it all ladders up to a question. So everything that we do isn't random. It always starts with a question. So it could be, what does end of life care look like? Or what does incontinence look like? Or how do we understand how people are being influenced about diet choices? All of these questions are things that we would work with, and then we work the data in a really structured way through. And we're not a machine. Our team are qualities at heart. So it's all manual. We read a lot. We process and sort of make sense of it that way. Does that make sense?
It does. It still sounds, that process sounds amorphous in terms of dealing with an amorphous set of data, though. So, but thank you for that answer, though. I appreciate it.
Happy to chat through more. We've got a really tight workflow, so it's not. Every stage is very structured. Every stage is very precise. And that's because I stood up in front of meetings when I first started the business, and the data hasn't been right, and I've not known to ask the right questions, and that's when I said at the beginning that we come at it with market research methodology and mindset. That's really important. So we understand, we've made sense of it. So it's not random. It's like it's the meaning is there because we've read thousands of people talking about being diagnosed as diabetes type 2. We know. We've got that depth of experience, and the important thing through that process is that depth of stories, is being able to see actually, right, you're all talking about this thing, but you're experiencing it in lots of different ways. And that's where, for me, the magic is, because you're able to then suddenly, instead of just having 12 people in a room who are there for some free sandwiches and a nice discussion, you've looked across 2,000 different experiences of the same phenomena. And you're able to go, okay, right, I really understand that phenomena now.
Okay, thank you.
No.
Other questions?
Jeremy, I have maybe a little bit of a follow-on to what you just described. So I have to imagine when you come to a conclusion or a resolution, that's a moving target, right? Things like the pandemic, changing market conditions, election cycles are all going to influence people's responses to maybe more finite questions that you're asking. So how do you account for that change in mindset over time as major world events occur?
Yeah, it's a great question. So we think about the context of which we started the work. So we can sample over a period of time, or it can be the last 3 months, it can be the last 5 years. And then what we do is then, if we know that these things are happening, we can look for spikes, and then within the conversation, then transpose those onto cultural events. And what's happening is that people are trying to explain to other people why they feel the way that they do and how to make sense of what's happening to them. So if it's culturally relevant, they'll then draw that back into their conversation. And also we know that after certain things, that it's like people stopped talking about COVID because they didn't need to talk about COVID because COVID was bloody everywhere. So it wasn't being picked up in the data, but we knew it was such a rich part of that conversation that it was obviously still informing what everyone's doing. So it's just being mindful of the broader, what's happening more broadly socially, and then how that impacts how people will be interpreting and making sense of the topic that you're looking at.
Thank you.
Good question. This is just for my clarification. When you say social media, can you define what that term means? There's so many platforms and they are very dynamic and change. So what do you look at either in existing platforms and for future platforms for social listening?
Yeah, I think social data is I've got a very broad definition of it. I think of it as user generated data that's shared. So it can be really broad. It can be Facebook, it can be Instagram. We do a lot on TikTok at the moment, Reddit, forums, blogs, Twitter, Telegram, all of it. It's all good. In terms of the definition, it's really, for me, it's the source where you haven't got, it's not a researcher asking questions. It's not a group of people in a room. It's not an agenda that's led by an organization. It's free flowing data and observational data. And that's what gives it the quality. It's you're observing data that's being created, not for you. That's, for me, is what makes it social data. Other people have got different definitions, and they say one thing is, but I think I've got a really broad definition of it. I would take review data, all of it. It's all good.
Mary and Laura, I think I see another question over there.
It's Mary this time.
Right, it's me. I'm curious, what about search engines? Is it all from social platforms, or do you use search engines also?
Yeah, we do. I think search is brilliant, right? So I once got a question that just changed my life. So it was like 2 days before Christmas, about 6 or 7 years ago, and a client called me and said, "We've lost a patent in one of our markets. I need to find every mention of 2-in-1 tablets in the Netherlands." And it's like, oh God, how am I going to do it? So it was young days. So I thought I'll give it a go. So I sat down and started Googling it, and I was pressing next and next and next and next, and I hit 800, and it didn't, and I ran out of Google. Okay, and ever since, Google have stopped it and brought it back, and now you will run out of Google at 200 results. It's 5 pages. We know that like 90% of people don't go beyond the first page, and then drops off massively on the second page. So for any search term ever, there are only ever 200 results, irrespective of what it tells you at the front. So it might say, I'm searching for bananas, there are 30 billion results pages. You'll never get more than 200. So what that means is actually the potential to search is much smaller than we believe it is. We believe that we've got this access to everything, but we don't. And so once you've got that in your head, you go, right, I can map out the knowable search universe. And so a little thing that we do in a lot of our projects is go, what are all the keywords that anyone could possibly search for? Then each of those keywords can only have 200 results. Then you mash all that up together and you do some weighting via what's top 5, what's not, so I'm getting a bit technical, and you can map out the internet for any topic. So you're thinking about, okay, affordable housing in Michigan. Okay, we can map all that out. Tires, winter tires in Germany, we can map that out. Diabetes care, we can map that out. Incontinence pads, we can map that out. Everything. It just because of those couple of dynamics. And how that changes over time with what's happening with ChatGPT and the future of search is yet to be seen. But right now, you have this illusion that is the whole world, and it's not. It's very, very narrow, because search engines know there's no point giving us all of it because we won't look at it.
Great.
Fascinating.
Cool, thank you.
I think we are actually up on time here. So just want to thank everyone. Thank you, Jeremy. Thank you, Karen. Thank you all for coming.
Thank you so
Thank
much.
you.
Thanks,
Awesome.
everyone.